folks out there, I'm Dr. Kajal Tyagi and I'm the Senior Consultant Physiotherapist. In previous video, I already explained you about upper cross syndrome, its symptoms, its causes, and shared some tips with you how you can manage it. But there is a bigger issue which is annoying your lower back day by day. The term is called lower cross syndrome. Actually, lower cross syndrome is not just a IT thing. It is related to bad posture, how you walk, how you stand, how you drive. I am giving picture here so you can understand which muscle is tight and which muscle is weak. But if you avoid this problem and dive into working out, you could end up this problem by creating sciatic pain or your lower back pain, and it will definitely impact your overall health. Actually, these muscle imbalance can occur when muscles constantly lengthened and tightened in relation to each other. In tight muscle, we include erector spinae, latissimus dorsi, adductus complex, and the flexus complex, gastrocnemius and gastrosoleus. And weak muscle, we include tibialis anterior, tibialis posterior, internal obliquus, transverse abdominis, gluteus maximus, gluteus minimus. This imbalance can create anterior pelvic tilt, means hyperflexion in your hip, and compensatory hyperlordosis in your lumbar spine. So basically there are two types of pelvic tilt. First is lower cross syndrome with anterior pelvic tilt, and second is lower cross syndrome with posterior pelvic tilt. So there are two types. Causes we include your sedentary lifestyle, your muscle weakness, your muscle imbalance, your bad posture. And in symptoms, you feel lower back pain, lower muscle tightness, and your hip pain, hip tightness, and knee instability and knee pain. So all these are included in symptoms. Basically, how you can check that you have lower cross syndrome? Sometimes you can by seeing only you can understand this. If your pelvic is little forward, then you have anterior pelvic tilt, or if your pelvic is little backward, then you have posterior pelvic tilt. And another way you can check, you have to stand in front of the wall. If your lower back creating a gap or arc between your lower back and your wall, then you are suffering from lower cross syndrome. Actually, I am giving picture here. By seeing also you can understand this. Now talk about management. In management, first you have to aware about this problem. You have to correct your posture by stretching, by strengthening, and do core mobility exercise, core stabilization exercise, strengthening exercise. If you do all these exercises, then definitely you can prevent this problem. In next video, I'll show you all these exercises. If you like this video, then like us, share us, and subscribe us, and stay with us for next video. Thank you so much.